doctor. Looks like I need an abortion.
An abortion?
Yeah, I've got one growing inside me. Now, you're gonna scramble its brains or just vacuum it out?
Whoa. Okay, so first, I'm not sure or know of any procedure where a man going to a female currently can then get a female organ and have it function. I don't think we're there in the science. I haven't heard of one where there was a uterus that was transplanted.
If you want, you can just scramble it and I'll queef it out myself.
Oh my gosh, the most inappropriate term. So that word ends up meaning just air coming out, and that typically can happen post-coital or after sexual encounters because of the air movements.
You're physically unable to have an abortion because you can't get pregnant.
But I missed my period.
You can't have periods either. You had a sex change, Mr. Garrison, but you don't have ovaries or a womb. You don't produce eggs.
Could you have a baby without ovaries? Potentially, if it is made outside of the body and then put back into the uterus and implanted directly in there. But there's also hormonal factors that need to play a part of this as well to allow things to grow appropriately, make a placenta, and have support of the body.
You mean I'll never know what it feels like to have a baby growing inside me and then scramble its brains and vacuum it out?
No.
That's right.
But I paid $5,000 to be a woman. Hey, asshole!
What? So you definitely cannot just walk into a procedure room, an OBGYN's office, especially even if you're not masked up, scrubbed in, and just in normal clothes.
I've already used your testicles to fashion new knees for a little boy who wanted to be tall and black.
Wow! You can't use these different organs and just transplant them in anywhere you want. It doesn't happen that way. What is he doing? Is he eating gold? Oh my gosh. If you are privy to having like a little bit of gold flake in a drink or a cupcake, that's inert. It's so small, it's not going to cause any issues and pass right through your system. Versus ingesting this significant amount of a metal, bad idea. Please don't do this.
It's been 3 days since 4 unidentified children were trapped in a cave-in. 3 days without food, and time is certainly running out. Hope.
So I wonder if he's like super heavy now because of all the metal. Depending on how much he ingested, you have a ton of feet of intestines that could basically store this stuff. You're gonna cause issues, and you're not just gonna be pooping out coins left and right. It actually probably is going to cause an obstruction.
Cartman, seriously, you need to see a doctor. No, I just need to get to a toilet. See you guys. Have it.
Would it pass through your system that fast? Unlikely. It would be covered in poop, probably be bleeding. You can even have bowel perforation to where you need an operation. Otherwise, the intestines are just going to leak all the poop inside your abdominal cavity, and then you become septic and you potentially die.
Hey, Jimmy, how was school?
Fine, Mom.
Jimmy, we understand you're getting erections in the classroom.
What?
That is awkward. Erections happen multiple times a day. The worst is when you actually then have to get up.
Just think about baseball.
The fact that the parents know that this kid's having multiple erections at school means that somebody's been notified and they notice.
Now, Jimmy, it's nothing to be ashamed of, but we know it's something you might have a hard time talking about. Get it? A hard time.
I love really bad puns. Oh my gosh.
So we took your counselor's advice and called Dr. Powell to help us all talk about this.
Dr. Powell?
Hey, Jimmy, I'm Dr. Powell. That's because I'm a doctor, but I'm also your pal. Are we cool?
Sure.
A lot of times parents call me in because I can relate to younger kids. I'm down. I'm dope. You dig?
Oh my gosh. I could totally relate that I've done this cheesy type of talk to patients, but I've done it in a joking manner. Usually I get a laugh, and that changes the dynamic of the room and makes people relax. If I definitely make jokes about myself.
Jimmy, there's nothing weird about random erections. Almost every boy goes through a phase where his penis becomes hard for no particular reason. It's just part of growing up. Growing up? Growing out is more like it. Oh!
So this Dr. Powell is actually saying some correct information, that it just happens, especially as we're going through puberty, as our bodies are changing. So that is good, and it's good to understand. It's just always awkward to have the conversation about it, right?
Come on, honey.
Jimmy, as you get older, your body goes through a lot of changes. Certain hormones start to release as your whole reproductive system begins to awaken. And so if you like, we can take off our shirts and kiss.
Wow. Totally inappropriate. In a hospital, if I need to examine anybody, any age, I'm with a nurse that's in the room, family members are in the room, and we only expose areas that need to be examined that are medically necessary. If this ever happens to anybody out there, please tell your parents, tell the police, tell somebody who can help you.
It matches your.
Wow, so I'm assuming he made fun of or said something about the headgear. I wore headgear when I was a young kid. Not cool to make fun of somebody who's just trying to fix their jaw, the way their teeth are. What is happening? Stan is getting thrown around so he can get abrasions, bruises, ecchymosis, hematomas. The TV that appears to electrocute him, but if it's not plugged in, there's no electricity. If it's connected, the biggest things we worry about are cardiac arrhythmias, messing with your heart because of the electricity, and then obviously superficial burns and muscle and nerve destruction.
Ready to go, Stan? Go where?
Glass, any major lacerations, they need to be washed out and cleaned at home, and then even in the emergency department, and then potentially sewn up.
To the genetical engineering ranch. We got Cartman's pig so we can splice its genes with my elephant.
Genetically splicing DNA of a pig into another animal.
Pig and an elephant DNA.
There are many rules, regulations, and laws relating to genetic manipulation of even animals. What the heck? Okay, wait a minute. So we're outside suntanning, smoking, and having some sort of light. Definitely looks like the x-rays that are at the dentist.
Dad, Mom says to stop trying to give yourself cancer.
Ah, there you go. Cancer in itself is the abnormal replication of a cell that's just gone rogue and it's going crazy. And it happens because of higher chances of these cells occurring during cell turnover.
Just gonna get a little bit of cancer, Stan. Tell Mom it's okay.
Sun is actually good for you. It actually helps with vitamin D production. Obviously, getting too much sun is not good for you. It can cause cell damage. With anything, too much of a good thing is not good for you.
Too much of anything is bad for you, you blithering twat.
If 4 million people play the brown noise at the same time... 1, 2, 3, pizza! No!
Oh! Sometimes people actually have an event where they actually have incontinence of their bowels, meaning that they cannot actually control holding their poops in. Like literally as the body peristalls to let the stool out, it just flows out and you have to wear like diapers and you run the risk of getting a significant amount of urinary tract infections if you're always kind of covered in fecal matter.
Tom, I'm standing in New York City, but it could just as well be any town on Earth right now. The desolation, the damage is exactly the same in every city the whole world over.
Wow, just looking at that scene, there was like poop on the envelopes going into the mailbox, all over the ground. I will tell you that people will poop in the emergency department. They will poop on the floor, they'll poop in the beds, they'll poop as they walk.
It's been just under 20 hours since everyone on Earth pooped their pants, and people still roam their damaged homes with disbelief and loss.
Imagine that there was a way to use this sound to therapeutically help people who are significantly constipated. You're able to use a sound instead of having to ingest a chemical into the body. Obviously, in the emergency department, I'm dealing with an emergency in that one moment. Trying to help people get stool out of their body, we try to do potentially a whole bowel irrigation, which is giving medications by mouth to help get it out.
God damn it! Who do they think they are?
I
Remember
love
the school
Cartman.
physical we all took last week? Yeah. Well, the school put the sizes of all our penises up on a big chart in the school hallway.
Come on. I do remember school physicals. They're checking for like scoliosis. They have you like bend over and they're looking for like the hump, potentially getting like hernia checks. If I'm looking for a hernia, I'm not feeling the testicles per se. I'm actually feeling above where the spermatocord comes out, higher up where the pubic area is. When you cough, you increase intra-abdominal pressure and you push the intestines further down if there's a defect in the wall that then needs to be repaired.
Why would they tell everybody that? They want to measure my wiener? Fine, but don't put me on blast.
I told you the students would be interested in how much they grew since their last physical.
Oh my gosh. So it's the growth of their height and not the size of their genitalia. I do remember that they always check their heights, but I even remember my own house. We went against like the doorpost and my mom would put a mark with a ruler and measure us over the years. Did any of you do that or still do that in the house? Let me know.
Hey, wait, the cold is making it shrink some. Where you going, little feller?
It definitely does. It has to do with blood flow, and when it's cold, the blood flow basically goes to our core of the body and gets shunted from the extremities, including your genitalia. And same with the scrotum. The scrotum shrinks up as well. If it's cold out, it brings the testes closer to the body to keep them warm.
Hang on, he's coming back out. There he is. Who's a little guy?
I love how he's
All
talking
right,
to his
looks like
penis.
we have 2.4 inches. Really nice, buddy.
I'm hung like a horse.
Very awkward when you're at the doctor's office and we have to do exams. We basically try to cover everything. Our main purpose is only to make sure that you're fine.
What we need to figure out here is, are we dealing with maybe a little bipolarism, some rage addiction?
There's actually multiple different types of bipolar. It typically has to do with periods of depression, periods of potential mania, or up. Sometimes people are more prone to one than the other. Some people will say at the blink of an eye, if you change from being depressed to super happy, that you're bipolar, or vice versa. It typically doesn't work that way. It's usually like days on ends of one behavior and then days on ends of other. And then depression, not eating, sleeping all the time, not interested in anything, thoughts of potentially wanting to hurt yourself.
Honestly, I wouldn't really care.
I think you're way too fat for your age.
Totally inappropriate. Should not be trying to entice this kid into anger.
Well, I just don't see it, Miss Cartman. Your son doesn't seem to be triggered by anger at all. In fact, I'd say he's one of the more even-tempered children I've ever seen.
Sorry, doctor, your wife's on the phone. Says it's an emergency.
I mean, web chat with what? No, I don't have a criminal record. Who?
I'm not fat. I'm big boned.
This big bone theory we have out there. Very rarely. I literally get x-rays and MRIs and CT scans every day that I work, and we can actually see people's bones, and the majority of them are normal sized bones. There may be issues of how people may have higher deposits of muscle or fat in certain areas of their body, which make it feel like somebody has big bones. Typically, we're all pretty much the same. The length of the bones are different, but the thickness of them don't vary that greatly. Finding the right person for the help is also a huge thing you need to think about, because you need to develop a relationship with this individual who's trying to help you, and if you don't trust them or you don't believe them, it may not help you and you may need to seek somebody else.
Tom, it's Tuesday
What the
morning
heck?
now, and the outbreak of SARS in South Park has reached epic proportions.
Oh no, so we have SARS. SARS is severe acute respiratory syndrome caused by a coronavirus. The first time we ever saw this where it was severe enough to hit the news recently was like 2002, 2003. So it hit people really hard, but it actually kind of burned out fast, where it couldn't spread as fast as SARS-2, which is what we call COVID-19.
The entire town has been quarantined by the federal government, nobody allowed in or out, which means nobody can come to our aid.
I hope we learned a bunch from this most recent pandemic relating to coronavirus on how to handle different situations, quarantining. Viruses continue to evolve, so there's potentially going to be something in the future that we need to deal with. Figuring out how to deal with it appropriately is of the utmost importance.
Someone spoke to me and told me the middle-class white way to cure SARS. Campbell's chicken noodle soup, Dayquil, and Sprite.
I mean, those things: soup, Dayquil, which is a type of typically a cough medicine, different types of ingredients in there, and Sprite helps with like bubbles, gas, carbonation, helps possibly with nausea. Everybody's doing great. Viruses in general are very hard to treat because they're not as easy as antibiotics. Bacteria infections, we're able to treat those pretty easily because we have antibiotics. Antibiotics are for bacterial infections. Viruses, we have antiviral medications, but they're not as good. They don't work as strongly. They don't just eradicate the virus. The body still needs to fight the viral infections, but maybe the antiviral medications will subdue it a little bit, bring it down so the burden is not so high, or it might reduce the symptoms by maybe a day.
Hey, Stan the man. How you doing, buddy?
I laugh because I have done this too. You try to be cool, you try to relate. I guess I try to, depending on the situation, the chief complaint, why somebody's there, try to make them laugh. It's actually my number one go-to.
The nurse said you came here by yourself, no parents?
I kind of wanted to talk about something in private.
Oh, okay, pal. What is it?
I think I might be horribly racist.
Okay, so he is wondering why he is racist. Stan goes to the doctor. He's underage. As an ER doctor in situations where minors come in without an adult, the law says if there is a life-threatening injury or event that's going on, you treat and make sure that the individual doesn't die because there's implied consent. It's good that the kid's going to a doctor for a resource to help. Maybe not the appropriate setting for what he's asking, but he just wants to know. He doesn't know where to go.
There's this kid at my school, and he's black. And his parents named him after the guy that wrote Lord of the Rings.
Uh-huh, Tolkien. Great name.
Yeah, well, I thought his name was Token. Like a black kid that's just there so that, like, there's a black kid.
Uh-huh. And how long have you thought that?
The whole time. I've thought that the whole time.
Poor kid.
Wow. You.
Oh my gosh! Probably not an appropriate response from adult to a kid. The kid literally is doing the appropriate thing of admitting that, the way his brain was thinking and going down that wrong, thought process. The big thing about being a physician is a patient to doctor relationship. For me as an ER doctor, we have to develop that relationship very fast and have to have trust immediately.
Get out of my office! You make me sick!
I'm sorry.
Wow.
I don't know what's wrong with some people. I thought I told you to get out of my office because you seriously make me sick. I'm gonna shit my pants right now.
Doctor, please, I don't want to be like this. I'll do anything. Just tell me what to do.
Well, you want to change? Then I suggest you start doing a lot of reading.
The way that this doctor totally approached the situation was so wrong and not appropriate. People don't respond to being yelled at. So if you're having thoughts as an individual where you don't think they're the right thoughts, or you feel like, the way you're thinking is maybe wrong, you need to talk to somebody about it. But then who do you talk to? Different types of therapists out there that you can talk to. There are social workers, school counselors.
Ow, my nose! You broke my nose! Damn, Pip, I didn't know you had it in you. Oh, I'm dreadfully sorry.
That nose is bleeding pretty bad, Kyle. I think you might have to go to the nurse's office.
Oh, geez. Nosebleeds are super common. The best way to stop it is pinch the nose, the soft spot, and lean forward. Typically, nosebleeds occur in two areas. One, there's an anterior part of the front of the nose where there's a bunch of blood vessels that form this area called the Kesselbeck's plexus. If it's a posterior, further back, what ends up happening is you're now holding a reservoir and you're allowing the blood to kind of pool and it'll form a clot. And when you form a clot, that's a good thing because then it'll eventually stop bleeding.
Oh. Whew.
Now, what seems to be the
Oh
problem?
gosh.
I just hit my nose playing dodgeball.
Oh, well, I'll get you an ice pack. I see you've noticed my disorder. I have a stillborn fetus growth attached to my head.
The kid's response is hilarious. Okay, just so there's no confusion, this stillborn situation would have occurred in the womb, meaning inside the uterus. Stillborn means that it's not living anymore. Wouldn't you have that removed? Back to his nose. If he broke his nose, most of the time you don't do anything to treat it. Most of the time it's fractured, which means broken, but it's not displaced.
And so I'm suggesting that this town puts all of its...
Oh!
Holy shit!
Randy?
Oh my gosh, okay. Right upper chest is your lung, bones, soft tissue, some major blood vessels that are coming off of the heart, what we call scene safety, and get the individual out of a scene where more detrimental things can occur. Oh my gosh. Hell's Pass Hospital.
I'm sorry, but he's in critical condition.
They're in Colorado, right?
Who shot him?
Nobody knows.
So interesting, the doctor's coming to the family in what appears to be the regular like lobby waiting room. What ends up happening in the trauma facilities that I've worked at, usually there's police involved and the police are actually there on scene at the hospital. Typically patients are not registered under their own names. It's like a code because you don't want, you know, somebody's looking for them to hurt them. If a family does show up, you actually put them in a family room. That way you can discuss so nobody else hears what's going on.
Be okay?
He's in a coma. He's unconscious and just blabbering nonsense.
Typically as physicians, we don't use coma. We try to describe it more because coma is such a non-specific term, meaning like sleeping. Are they sedated from the medications that we're using? But then the doctor says here that the spurting gibberish. So they're not necessarily in a coma per se because they're actually talking, but they might be delirious, altered, those sorts of things. So I see a bandage on the arm, so maybe you didn't get right upper chest, maybe arm, which typically, if you're shot in the arm, it shouldn't cause somebody to be unconscious or requiring sedation at the hospital, unless the bullet tracked into the chest cavity and caused major issues there.
Mr. Marsh, your whole family is here. Your wife, your daughter, and your son. Konnichiwa!
Sometimes stress can cause a lot of significant speech changes, could cause somebody to have so many different reactions. But our job first is to rule out any identifiable cause outside of stress and anxiety that would cause these changes.
Timmy? I told you, put on the hat!
I mean, those types of crutches, braces are actually metal and cause a lot of trauma and damage. So there's other ways to resolve conflicts other than just fighting. And you never know. You can actually cause severe head trauma, bleeding in the brain, skull fractures, a lot of different things that can occur, smacking your head on the ground. Literally, that kind of fall can crack your skull open, can cause bleeding in your brain, and can potentially kill you. And it's not even that great of a fall. Great meaning like height. Humans can actually bite fingers off. It takes the same amount of force as biting a carrot. I've yet, in my many years of being an emergency medicine physician, have not seen a finger bitten off. It can cause a lot of pain, yes, and increase the risk of infection because of the bacteria that's in a human's mouth. Okay, and again, somebody's paralyzed. Do they have sensation and feeling? So that he's getting hit in the groin. That depends on where on the spinal cord there's issues. Is it just a motor function problem? Is it a sensory issue? It just depends because the spinal cord is so complex. The nerves for these different types of feelings are in different areas.
You think HIV is something to be laughed at, Kyle? Well, let's just see how funny it is now.
What? What is HIV? The human immunodeficiency virus. It's transmitted through blood, not typically bodily secretions like saliva. It's called a blood-borne pathogen. Put it in Kyle's mouth. If you swallow it, can you get it? Probably unlikely. But if there's any open areas because of the mucosa, if there's a cut and it can get into your bloodstream that way, then yes, there is a chance that you can actually get infected that way.
There, Bubby, you'll be okay. Oh, doctor, did you find anything? Is it strep?
No, it isn't strep.
Oh, well, that's a relief.
HIV is a virus that attacks our immune systems, the human immune system, runs it down so much that then we increase the risk of having other infections, opportunistic infections, that when our systems are down, they can come and harm us and potentially take our lives.
Mrs. Bravlowski, has your son ever had a blood transfusion?
No, why?
Little boy, have you been having unprotected anal sex?
What? No! Doctor, what are you saying?
Typically, ways of people getting HIV transmitted is blood transfusion, sexually transmitted, meaning not just anal sex.
We've run every test imaginable.
Little Kyle here is infected with HIV.
Whoa. The concern is it's a virus, so there's not a lot of treatment for it. We have a lot of different medications out there to suppress the virus enough to where it's maybe not detectable and not affecting our body, but there's no way to specifically eradicate it that we know of yet.
What? HIV?
It took us a long time to narrow it down, but there is no doubt.
No, that's impossible.
So doctor's saying, hey, it took a long time because, again, kind of vague symptoms of a virus. It could be so many different viruses. At the beginning of the COVID pandemic, the panel for testing viruses was just huge. Now we've narrowed it down.
Young lady, are you absolutely sure you want to consider this kind of procedure for your breasts?
Yes, I want to get breast implants.
What? There are cosmetic procedures that are done to the pediatric population or anybody below the age of 18, but typically it's related to anything that would fix a potential disfigurement. A classic example would be a cleft palate.
I tried to tell her she was too young.
Well, it is a different time, Mrs. Testaberger. Society puts a lot of pressure on your daughter to look her best. Having small breasts can make her feel unimportant.
But she's 8.
Yes, well, not too young to feel flat and therefore not pretty.
8 years old, not even potentially going through puberty yet. As we go through puberty, our bodies do change, and it takes many years, actually. In the United States, parental consent is required for any cosmetic surgeries for any individual below the age of 18.
However, young lady, I'm afraid breast implants are not for everyone. I'll need to carefully assess your physical and mental condition to see if augmentation is truly the best way for you to go.
I have $3,000 cash.
You pass, let's do this thing.
Oh my God, that is horrible. No. I know there are doctors out there that do a lot of cosmetic surgery. They won't do surgeries until they maybe have had a psychiatric assessment to make sure that they understand the consequences of what they're doing and they've thought this out.
What we do is make a small incision in the armpit where it won't be seen. Then we take this little plastic bag and gently place it in the chest where we fill it with salt water.
The surgeon is giving the ease of the procedure to ease the patient as well as the patient's family member. But you also have to discuss the consequences, the risks, all aspects of surgery. That way you know what potentially could happen. Oh my gosh. Oh my gosh. And look what happened. This is just awful. The tissue is not stretched. It's not able to expand that fast. If I eat tons and tons of calories, my body's going to expand, but my skin does need to stretch because of the different components within the tissue.
Whoa, dude, who the hell are you?
Mr. Garrison, there's some freaky kid from the planetarium on our bus.
We better get him to the nurse's office. Stay.
Yep. Bring to the nurse's office, maybe acting a little erratic, confused, but then also sweating. The differential diagnosis could be multiple different things, including infection around the brain. Fevers can do this.
Fever.
Unlikely delirium. Medications can do this. Seizures.
Planetarium!
I'll give him a painkiller. That should calm him down.
No.
The individual is being restrained. This actually happens a lot in the emergency department for many different reasons, medical reasons, illegal substance reasons, and our ultimate job is the protection of that individual.
He's stable, but I still can't get any information out of him. I'm going to sedate him now.
No drugs.
Drugs are good, okay?
The appropriate standard of care that we would typically do for somebody in this state. You don't just do everything under the sun. You try to get in touch with the parents. You discuss the presentation of the individual and say, okay, this is our plan. This is what we're going to do.
Don't let them go. Planetarium.
Oh, why, Van Gelder?
The machine.
He's been talking about the machine for hours.
Okay, wait a minute. The nurse looks like it has fetus in fetu, but it looks like this nurse in this clip has left that appendage still there.
There's only one way to get any sense out of him. We're gonna have to try a mind meld.
A mind meld? I don't know what that is.
One and together.
You try to talk to them. You try to do a lot of things before you do sedation. And again, you want to make sure the medications are not going to interact with anything that they might be taking or make them worse.
Yes, I'm afraid you're a little sick, but it's okay. Because together we're going to get you well.
Don't listen to Dr. Janice. He's a mean old man and a big silly grown-up.
Pardon me?
He's just a big old stick in the mud who doesn't like to play.
Looks like maybe the doctor has his own medical issues.
You've got a condition.
What we used to call multiple personality disorder is now actually called dissociative identity disorder.
Don't mind him, Butters. Billy's a pretty messed up kid. He was molested by his uncle, you see.
Dr. Janus isn't going to be alive for long. I'm going to kill him. Now, what are the things that make you happy, Butters?
Doctors are human beings too, and they can have multiple medical problems going on, psychological issues going on. They might be a patient just as much. The most important thing is that the doctor's own medical conditions are not interfering or inhibiting the appropriate care for other individuals.
Your son is suffering from multiple personality disorder.
What?
From what I gather, he seems to mostly jump in and out of personalities when he's outside playing. Sometimes he's a cowboy, and other times he's an Indian. And the two seem to be at constant odds.
Oh, poor Butters!
Oh my gosh. So he's literally describing like a normal kid. Typically, if there is something that we would identify as abnormal, you don't just jump to medications first. Sometimes you can do different types of therapy. Throwing a kid or a pediatric patient immediately on medications doesn't seem appropriate in this setting.
Someone just has to activate it like the proctologist did.
Oh, no. Nobody is putting their finger in my again. Unless it's Kyle.
There are times when doctors have to do a DRE, a digital rectal exam. Sometimes we're looking for internal hemorrhoids or feeling your prostate or feeling the integrity of the wall of the anus and the distal end of the rectum.
What? No way! You do it, Kenny.
Nope, it has to be Kyle.
Humans, we come in all different varieties, shapes, and sizes, right? And some individuals' fingers are very large and long versus some are like very skinny and short. So maybe that's why he's picking Kyle.
I'm not putting my finger up Cartman's butt.
Kyle, the fate of the world may be at stake.
Come, Kyle. Do hurry. Go ahead. It won't bad.
Oh my God, put a glove on, come on. And you need to use lubrication.
That does it! Charge!
What the heck is that? Holy cow, this is a huge satellite. I have seen many different foreign objects accidentally found in the rectum. Sometimes people obviously will tell us that there's something in there versus they fell on it, so to speak. Oh, wow. A lot of times we'll get images, make sure there's no perforation of the bowel, see how far up it is there's ability to get it out. We will attempt to get it out in the emergency department. We might use a little bit of sedation, but if it's too far up, we actually would have to have somebody go into the operating room for possibly a colonoscopy or a sigmoidoscopy.
Out front of the stem cell research facility with terrific news. Christopher Reeve claims that he can now stand.
Wow, so Christopher Reeve, that was the original Superman for all of you out there who don't know. He had a high cervical injury, I believe, and he was in a wheelchair and had a tracheotomy to help him breathe. Stem cells, obviously an important topic, could be controversial.
To most people, this is just an ordinary fetus. But to people like me, it's hope.
Yeah, you wouldn't just be having this fetus laying around. No! No, that is not how this works. That is awful. You're using cells. You're not actually using the body in that way. You're not ingesting them.
What an inspiration.
Man, that's just disturbing. You know, you can use amniotic fluid in similar circumstances. And then there's other technologies like CRISPR, which has to do with gene modification.
Tom, many celebrities have spoken out in protest of stem cell research, but after seeing this, how can they protest now?
Oh my gosh.
Stay clear, guys. Stay clear.
Yep, I'm not saying anything.
A lot of amazing things can happen, and a lot of things that could potentially be scary in the sense of abuse and not being regulated. Oh, jeez.
Here, give me another one. Give me another one.
I'm like, are they all sick? No, they're trying to smoke a cigarette.
Oh, here comes Mr. Mackey. Throw him away.
Oh, jeez.
Dude, here he comes. Gotta stop coughing.
So, why are you coughing so much, right? You're literally inhaling smoke into your lungs. Of course, it's an irritant. Your lungs don't want that in there. It's going to cause you to cough. Please, don't smoke. Oh, are they gonna puke or are they trying to cough? Yep.
Ah, sick!
Gross, dude.
Was that all phlegm? Oh, that was all phlegm. Gross. A lot of people can't deal with like phlegm and spit. Colors of the phlegm sometimes matter, sometimes doesn't. So they'll be yellow or green. Could be related to what type of cells are being broken down. Doesn't necessarily mean what type of infection you specifically have.
Well, hey, if I didn't know any better, I'd think you boys have been smoking.
No,
Look at how stringy this phlegm is. It can be very nasty and stringy like that.
Well, you better not, because let me tell you something about smoking. Smoking's bad.
Yep, the dumpster is now on fire. Fire! So many people smoke cigarettes and they throw them out the window, throw them out in the environment. It's polluting. And if there's still some ember there, then it could catch on fire, especially if an area that might be very dry, and increase the risk of burning down buildings, forest fires, the works.
If you start smoking at an early age, okay, it's gonna be bad.
The temperature would be increasing around you. I think you would notice. And if you're that close to the fire, the smoke is actually going to start bothering you and causing you to cough and hurting your eyes. We do see a lot when people come in after smoke inhalation. You'll have some redness to the sclera.
Smoking can lead to all kinds of health problems like cancer.
Biggest thing we worry about is just to make sure that the lungs look okay, make sure there's no massive inflammatory reaction, as well as make sure that there's no spasming or inflammation of the airway itself.
Okay, let me tell you something about cancer. Okay, cancer's bad.
The other concern is you're worried about carbon monoxide because of the different materials that could be burning.
Hi, we're here to visit our good friends Tweak and Craig.
Oh, well, I suppose a quick visit is okay. Maybe you kids can cheer them up.
Yeah, obviously visiting somebody in the hospital is a nice thing to do, but if you're underage, they're gonna want a parent with you. The hospital needs to know who's in the hospital, who's walking around. You'll get a guest or visitor pass.
Multipass.
And there's specific visiting hours. You can't just show up at any time of day.
Hey guys, how you feeling? We just came by because we have something to tell you. Yeah, see, we got you to fight just because we wanted to see who was the toughest. We made up all that stuff we said to get you guys mad at each other.
Left eye swollen shut. Could be many different things. You can actually fracture a bone around the eye and then accidentally sneeze and then have your tissue fill with air and then it seals it shut. The eyeball itself could actually be just fine. Unfortunately, if I were to see this in the emergency department, I'm going to try to actually pry those eyelids open.
We'll just live with the knowledge that you're both kind of sissies.
Oh.
Well, I mean, that's what was on the news. What was on the news? Oh, you didn't see it? Tweak's family was on the news saying what a wuss you are, Craig. Huh? Yeah, and then Craig's family came on and said Tweak was the wuss, and then punched Tweak's mom in the hooters.
Looking at the EKG monitors or the cardiac monitors in the back, the rhythms are all over the place. If you are moving and getting excited, the rhythms will change. You need to remain really still to get a baseline.
You're not even close to baseline.
And then we will repeat it as things evolve, but this way we are aware of what's going on with the body in those moments.
You son of a... I'm gonna take your... Come on, Tweak, you got him! Demo technique, Craig, demo technique! Put it on target!
I've seen patients' families get into arguments, and I've seen patients yell at each other through the curtains, but nobody actually getting out of bed and causing a ruckus like this. The nursing staff and the techs on the floor of the hospital will be aware of what's going on.
It just freaks me out, Doc. We all have these things living inside our bodies, and everyone just seems fine with it. It's like as soon as people learn they have microbiomes, the first thing they want to do is start swapping them.
What the heck is the microbiome? It is all those micropathogens that are inside of our body, and most of the time we're referring to in our gut. It's becoming more popular. People are studying it.
Well, young man, the truth is we still don't know a lot about the microbiome, but you shouldn't let it freak you out.
But where does it stop? Then are people just gonna start wanting skinny people's microbiomes to be skinny? Or an athlete's microbiome to feel athletic and young again?
We do fecal transplants on individuals that have really bad infections with C. diff colitis. When certain antibiotics fail, you basically get a transplanted version of somebody else's poop into your gut, and you get their microbiome, which helps rebalance all the microorganisms.
Yes, it's possible, but we don't know enough. There is no super feces which can make you athletic and young.
Well, like, what about Tom Brady's poop?
Can you actually get the superpowers of the individual that you get their microbiome from? I don't think so. I don't think it's even theoretically humanly possible, but it's a great idea, cool concept, and who wouldn't want to be Tom Brady?
The spice.
I'm just saying that Tom Brady seems to work really hard on his diet and stuff. His must be pretty good.
More than pretty good. The spice Malone.
Spice melange from Dune, right? Spice. Who's excited to see the next Dune? I am.
It's my understanding that you have an acute case of fecophilia.
What's that?
Well, a fecophiliac is somebody who's obsessed with mookie stinks, Kyle.
Fecophiliac. That's not something I've ever come across. We have patients that sometimes will throw poop at staff members or smear them on the walls. Yep, we have to deal with that.
Right now, you're nuttier than Chinese chicken salad, okay? And in the meantime, I'm gonna put you on a heavy regimen of Prozac.
Prozac is a medication that's an SSRI that is used for people who have anxiety and depression. Typically, you have to be aware that when somebody actually starts an SSRI, you have to counsel individuals that your symptoms could actually get worse for a few days before they get better.
Hello, we need to commit our friend Kyle, please.
Reason?
I'm a clinically depressed fecophiliac on Prozac.
Any allergies?
No.
Jacket!
Oh my gosh! I don't work at a psychiatric hospital, but we deal with psychiatric emergencies that come to the emergency department. We'll do medical clearance when somebody comes in and say they want to go to a psychiatric hospital. The requirement to pretty much get into a psychiatric facility is really difficult because they're so limited.
I guess they needed the extra bed.
The machinery of the V-chip is very simple. It is placed under the child's skin, where it emits a small shock of electricity whenever an obscenity is uttered.
This implant doesn't seem like it's under the skin. So if it was under the skin, it'd be super easy procedure. We do a lot of monitors that we can do on top of the skin. And there are some cardiac monitors that a cardiologist can implant under the skin versus this appears to be like inside the brain.
Say Montana.
Montana.
Good. Now, pillow.
Pillow.
All right. Now I want you to say horse.
Horse fuck. That hurt, goddammit!
Just to use technology to stop kids from swearing, I think is a little excessive. I think you'd all agree with me. The whole classic, like, please don't implant a chip in me.
We should all take a bunch of cough medicine.
Cough medicine?
That's what the 6th graders do behind the school at recess. They take way too much cough medicine because they say it makes them see things in their head.
Oh my gosh, bad idea. An overdose of dextromethorphan causes hallucinations, you kind of feel drunk, and it also causes rotatory nystagmus, meaning like your eyes go in different directions. There's no real treatment for it except for like supportive therapies. Please don't do this. Cold and flu.
There sure is a lot of them. How do we know which one to use?
How about this one? Calmanex. Warning, taking more than the recommended amount can cause severe side effects. That sounds perfect.
Simple things like aspirin, Tylenol, ibuprofen are all very dangerous if you take too much. If you take too much ibuprofen, it can actually cause permanent kidney damage. It can also cause ulcers in your stomach.
We need to come up with some ideas and inspiration, so we're gonna drink a bunch of cough medicine.
Whoa, boys, that's not what you need to come up with ideas.
It's not?
No. What you want is Calmanex PM. It has the dextromethorphan in it that causes hallucinations.
Tylenol or acetaminophen or paracetamol, that can actually cause liver damage and actually kill your liver if your liver actually starts to not function. It is a slow, painful death over a few days.
Now, if it's more of a lucid, speedy kind of high you're looking for, I do also carry the Day-Tap Cold and Flu. Then there's the maximum strength Cortitussin Cough and Cold. But of course, that's only if you really want to trip balls.
Aspirin causes somebody to become quite acidic, and you have to figure out how to make the body more alkaline.
I guess we'll just take all of them.
Oh
That's the
gosh.
spirit. All right, boys, I just need your parents' permission.
All right, now everybody take a tablet and a pencil, and when all the ideas start coming, just write them down. Stan?
Stan, are you getting good ideas?
Please don't overdose on medications. Please talk to somebody if you're feeling like you want to hurt yourself. There are many phone numbers out there. We'll put in a link in the description below if you're feeling like you need help.
Hey, this is great.
It's a special recipe.
God,
Oh
this is
gosh.
really good, Scott.
I'm glad you like it so much, because now that you're almost finished, I have something to tell you.
What,
Uh-oh.
you mean about how you put pubes in your chili?
Eating hair, probably not that bad for you. Sometimes people might eat too much hair and it can actually form a bezoar or a big ball of hair in the stomach and can cause issues, and it can cause like malabsorption issues as well as bowel obstruction. So that's one thing to think about.
I warned Mr. Dinkins that violent pony killers were in the area. You would most likely send your parents. And I'm afraid that when Mr. Dinkins spotted them on his property,
He shot and killed both your parents.
What? Oh my gosh. Head injury, chest injury, and an abdominal injury. The head and the chest, you would probably succumb to the injury pretty fast. Abdomen just depends on how close and how much destruction did it actually go through all those organs underneath, or is it caught in the soft tissue? Hard to know.
After a night with the hacksaw, I was all ready to put on my chili con carnival so that I could tell you personally about your parents' demise. And of course, feed you your chili. Do you like it? Do you like it, Scott?
Oh my God!
Oh my gosh, this is so wrong. It's so disturbing. Eating human beings, cannibalism.
You're talking about cannibalism.
Not recommended. We live a long time and harbor disease.
Hey, do you need to get in shape fast? Want to look your best? Tired of the other guys getting all the chicks? Are you tired of being a 90-pound weakling?
Yeah, I only weigh 90 pounds.
Then bulk up quick with weight gain 4,000.
So being 90 pounds and you're 10 years old, yes, you probably shouldn't be trying to gain more and get beefed up. Gentleman in the commercial is wearing a weightlifting belt and not even weightlifting. Okay, just something to think about.
Just think about it.
4,000 grams of saturated fat per serving.
Oh, 4,000 grams of saturated fat. No, bad. Please, no, that's a lot of saturated fat. Right now, there is obviously like debates about saturated fats, but 4,000 grams of this is definitely not good for you.
That's too much, man.
Enter the mouth and go directly to the stomach where it is distributed to the bloodstream.
Does the absorption get right down to the bloodstream? And there's a little bit more pathways that are going on.
Beefcake!
Beefcake.
Beefcake!
Beefcake.
May cause irreversible damage to the kidneys and liver.
Yes, irreversible damage to your kidneys and liver. So please be aware when they actually say that. You think about dietary saturated fats is not good for you. It could be affecting your kidneys, your liver, your heart, even your blood vessels.
Mom, can you get me some weight gain 4,000?
Okay, Eric. I'll get you some at the store tomorrow.
But Mom, I need it for tomorrow.
But tomorrow is grocery day, Eric.
This is sweet.
Oh. Typically, you wouldn't expand that quickly, but yes, it could be quite detrimental to your health, increase the risk of metabolic syndrome, could increase the risk of leading to diabetes.
Diabetics.
And I'm looking totally ripped. Beefcake. Beefcake.
I don't think they're gonna be able to get all of you in frame, Cartman.
This is why you can't literally trust everything people are selling. You have to do your own research, see why some ingredients are included and maybe why others are not, and see how it would affect your body in a short term as well as a long term.
Well, hello there, little girl. My name is Dr. Hallis. What can I do for you today?
So very interesting. You walk into the doctor's office and got the fake skeleton there. Sometimes those are actually good to have in the office to show different anatomical things that might be happening. A random skeleton that looks like it's from Halloween, probably not the best unless this is just an orthopedic surgeon looking at bones.
I want to have breast reduction surgery.
The individual's looking at breast surgery, so probably not just an orthopedic surgeon, because those are done by plastic surgeons.
Well, young lady, I'm afraid that we don't offer breast reduction surgery to girls of your age.
Why not? Britney Spears got fake ones when she was a teenager. Why can't I have mine taken off?
Because making breasts larger is a beautiful and wonderful thing.
Oh my gosh. A lot of procedures require you to be in the United States at least 18 years or older, or having parental consent, and the parent has to actually be there.
I'm afraid I just cannot ethically perform a breast reduction surgery on an 8-year-old girl.
Damn it!
If, on the other hand, you'd like to make them a little bigger, I think now might be the right time to size up.
Totally inappropriate. There's nothing wrong with an individual wanting to augment their body. It is their own body and it's their choice, but it needs to be informed and be of a certain age, especially following the laws in the United States or whatever country that you are in. And that way everything is done appropriately.
I need some help over here. Please help. I think he's got third-degree burn.
They're in an operating room. How did this individual get past everything else and show up? Operating rooms typically are like deep within the core of the hospital or even maybe on another floor above the ground floor.
Give the child to me.
Oh, geez.
Is he going to be all right, doctor?
Oh, no.
Is he going to live?
Is somebody having a psychosis? Are they having a nervous breakdown? Are they septic, meaning do they have a bacteria in their bloodstream causing fevers and altered mental status? Or do they have a brain tumor that's pushing on certain parts of the brain, causing them to have an altered sense of reality?
Ultrasound is very simple, Mr. Marsh. We're going to use harmless waves to look inside your belly. Just going to put some warm gel on your stomach first.
Ooh.
Unfortunately, in the emergency department, we do not have warm ultrasound gel, so it is cold. We will pre-warn you, and we don't just squirt it on your body. We put it on the probe itself.
Okay, take a deep breath. I see the crap now.
Poop definitely shows up on images. You can see poop on an ultrasound, but if there's a fart in there, it'll get in the way and make the image distorted, and then you can't see it.
Can I see it?
Sure. This is your colon, and here is the feces.
Actually, when you see the black on the ultrasound machine, that is typically fluid that you're shooting through. And then when it hits like an organ, it actually turns out white and degrade thereafter into a grayscale. Oh my gosh, it's got a big poop baby in there. Better images to see poop would probably be an X-ray, maybe an MRI, but CT as well. So typically we see a lot of poop on people's CT scans. We can see how much is filled in your colon and your small intestine.
I talked to the FSM and they say Randy has to take the crap in Zurich. I'm sorry, Mr. Marsh. I cannot condone you traveling on an airplane in your condition. It is never safe to fly during your third trimester.
That is awesome.
That's awesome.
We are talking about first, second, and third trimesters relating to a baby's development within the uterus versus a turd. I've seen people with something called a fecaloma, where it's actually such a large turd that it's actually calcified.
Maybe enough cash shot directly into the bloodstream could kill the virus altogether.
I have enough cash for all three of us. We should give it a try.
What?
No, it's ridiculous. We need FDA approvals, control studies. I'm sorry, but this is impossible.
You need to go through different experiments, so to speak, and studies and trials. The first one is always safety, to make sure it's safe. And then you have to see, does it actually work against what you're actually making it for?
Let's hope to Christ this works.
Typically, when you have an injection where you're doing intramuscular or subcutaneous underneath the skin, not in the muscle, you don't do large volumes like that because it leaves an unsightly large lump and can be quite painful and can cause potential ischemia. So you don't want to do that.
Wait a minute.
Oh my gosh, oh, that's what it is.
Yes? Yes, take a look. The cash particles have completely replaced all the HIV in Kyle's blood. You just found the cure for AIDS.
All right.
It's interesting that we use HIV and AIDS interchangeably. HIV is a virus. AIDS is the syndrome that's caused by the virus. They're typically not interchangeable, even though we use them that way.
They found the cure for AIDS!
So there aren't really no cures for viruses. There are ways to prevent the virus, there's ways to give us immunity, but even then, when we have the antibodies in our system to those viruses, the virus still comes into our bodies. Hopefully our bodies turn on and we neutralize it.
What's going on? They're trying to save Clyde's mom. From what? They're saying Clyde left the toilet seat up again.
Just crack the porcelain, I guess. I mean, you gotta be careful of causing lacerations to somebody because when you actually break porcelain, it's like glass, so it can be super sharp.
When she fell into the toilet, she also made it flush. It created a suction that's literally pulling out her insides.
First thing I think of, obviously, is a rectal prolapse, and this actually does come into the emergency department. And what do I mean by a rectal prolapse? Your rectum, which is kind of the last bit of your large intestine before it becomes your anus and goes outward, flips the other direction and comes out, literally.
Literally? Can't we disconnect the toilet from the plumbing?
Yes, we'll have to, but when we do that, the change in pressure will rip out her organs.
Wow, interesting. Typically, your organs would not all come out of your anus because they're not all connected that way. Maybe they're describing it as a hole or a vacuum to suck everything out, but again, they're attached in all different places. We know this.
We notice.
Please, oh God, please, let me go, let me go. Do it, do it, do it.
Seriously? Seriously? Oh my gosh. What organs are in the abdominal cavity that you're worried about that are coming out? So besides your intestines, the large and small intestines, you're talking about the kidneys. You have your liver and you have your spleen, you have your stomach, you have your esophagus, you have your pancreas.
I'm here to announce a new product that will once again revolutionize the way we use our phones and tablet devices. Let's hear it for our volunteers.
Oh my god. It's interesting that their feet aren't actually strapped down. We have in the emergency department times when people do need restraints. And typically you do 4-point restraints. Sometimes you'll do 2-point restraints, but typically if you're restraining somebody, if you don't do all 4s, they will get out.
These 3 people have agreed to be brought here, handcuffed to these beds, and become the prototype of our first truly interface device.
We don't use handcuffs on patients in the emergency department for restraints. We do have people that come to our emergency department, especially if law enforcement brings a patient. From a medical standpoint, we do not use handcuffs, and oftentimes we ask them to have them removed.
Their lips will be removed, and they will be sewn together mouth to anus. You agreed to this, mouth to anus, so that the feces from the gastral tract from one will enter the mouth of the little boy, and he agreed this was okay.
We actually have a lot of medical issues that occur because fecal matter then being ingested and different disease processes that occur because of that.
I know, it's pretty gross.
Making a product that is part human and part centipede and part web browser and part emailing device. I give you the human centipad.
Oh my gosh, who comes up with this? Typically, the only time we ever use fecal material in a positive note is for fecal transplants, when somebody has had their own digestive system so injured, the only way to recover from it is to put the gut microbiome of somebody else in there.
Looks good, guys. Great work.
Oh my god, oh my gosh, that is totally inappropriate. I don't even know what I'm looking at.
What the hell am I looking at?
They're saying, oh, this individual said, okay, I'm okay with this procedure or whatnot. Majority of the time, it needs to be written down. There needs to be consent. But there are times when we will emergently do something without somebody's consent based on the fact that it's an emergency.
Chuck E. Cheese!
Who knows what Chuck E. Cheese is? Who likes Chuck E. Cheese?
Chuck E. Cheese.
Uh-oh.
Thanks for telling Marcus's birthday.
The first things that you think about due to the fact that the person is having difficulty with their stance and slurring their speech and coordination, alcohol use, you think stroke, you think hypoglycemia.
I'm hypoglycemic.
You think drugs, altered due to an infection. So a lot of different things can happen.
What's wrong with him?
Can't you tell he's high on painkillers?
Oh, there you go. To be two.
Never meant to cause you any trouble.
Oh, man. Him vomiting, the things that we think about, reaction to the medications, and then aspirating. So do you actually end up inhaling your own vomit, which increases the risk of something called pneumonitis?
Percocet and Oxycontin found wrapped in his cheesecloth.
So Percocet and Oxycontin. So Percocet is acetaminophen, Tylenol, as well as oxycodone, and then Oxycontin is a longer acting version without the acetaminophen.
Prescription drugs, but with no prescription.
Prescription drugs in a vial that doesn't have a prescription on it. That's all you can tell from that situation. Could they be illegal substances or illegally obtained? Yes, because they are illegal substances, legal prescriptions, but they may not be obtained appropriately.
You guys know where all these illegal meds are coming from?
Most likely from the prisons. Whenever there's a drug epidemic, you can usually trace it back to people who've been thrown away by society and forgotten about.
For many years, we've been having an opiate crisis where lots of opiates are coming into the country. When I used to work on the East Coast of the United States, there's a lot of heroin, pills like Percocet, Oxycontin. But now you're seeing, a lot of fentanyl, which is a lot scary because a very small amount of fentanyl can cause a lot of problems.
I understand that today they are performing Chuck E. Cheese's autopsy.
Oh, the kid's party performer, yeah.
There are times that the medical examiner, we call the Emmy, will take the case, meaning they will perform an autopsy to figure out how the person actually died. But if it seems routine, if there doesn't seem to be any foul play, typically they do not.
As a concerned member of the public, I wish to be present.
Sorry, children aren't really allowed in autopsies.
Then I shall wait here to learn the coroner's findings.
They actually then will release the body to the family, but then at that point, the family could elect to have an autopsy or a medical examiner take a look at the body for an autopsy, but at their own expense, I believe.
Toxicology report shows subject had massive amounts of opioids in system at time of death.
Now proceeding.
When we do a toxicology report or do a tox screen on an individual, typically in the emergency department for blood, we're looking at aspirin, Tylenol, and alcohol levels. And then in the urine drug screens, then we're looking for all the metabolites of different illegal substances. Yeah. Okay. To just cut off the mask. Some people cannot handle different scenarios, and thus one of the more common things is to vomit. You just don't want people passing out. That's the biggest thing. When they see blood, a lot of people get woozy and pass out.
We found nothing else except for 2 Hummels in the subject's rectal cavity.
Hummels.
His rectal cavities.
These little Hummels are figurines. Little things do go up the anus often. People come to the emergency department that have accidentally fallen on them or lost them. It's okay. Some people use different things for different reasons, different strokes for different folks.
And you do not find this out of the ordinary?
Not at all. We found Hummels in nearly all the birthday entertainers' anal cavities. It's very common in our overdose victims.
The question is, are these figurines loaded with opiates and did it release? So we get concerned because I live in Southern California and near the border that we have individuals that come in as drug traffickers.
Excuse me, what are you doing here? If you want to be in the OR, a pass is required.
I don't know. I'm supposed to show these mountain lions how abortions are performed or something? I know, it's ridiculous.
What is an abortion in medical terms? In this aspect of it, it's the termination of a pregnancy. There are multiple reasons why this would occur, but these are typically elective abortions versus emergent abortions.
Well, you're in luck, I'm happy to inform. It's only 3 days until Christmas, so I have lots of abortions to perform.
Why is that a thing? Maybe because he's going on holiday or the hospital is not doing surgery, so has to do a lot before holiday? Okay, so we're in the operating room. Obviously, this is not a sterile situation. The mask should be up. You would have somebody else helping you put your sterile gloves on, typically. It would be a very sterile situation.
This better have a point, dude. This really better have a point.
I mean, I feel the same way, man. Not sure why Stan is all bruised and bleeding. If it happens to be from the cats, then you get worried about cat scratch fever, right? Typically, there's specific bacteria relating to cat bites and scratches.
Dad, what the hell are you doing?
Oh, Dad doesn't look
Hello,
good.
Stan.
Dad, it's the middle of the day. I thought you weren't going to drink as much anymore.
No, Stan, you don't understand. I have a disease.
Typically, alcoholism relates to a disease of addiction. Stan's easily just saying, hey, just stop it. But it's really hard for an individual who is down this path.
Daddy's very sick.
What? Did you go to your AA meeting?
Yes, they're the ones that told me. I thought I could just quit drinking on my own, but it's an illness, son.
Stan's dad needs more intensive help to assist with his alcohol addiction. If you just are the occasional social drinker and you want to help protect your liver, I formulated a supplement that supports alcohol metabolism and hydration. You can find it at lifehappens.com or on Amazon.
I have to admit that I'm powerless to this terrible disease.
Dad, you've had enough. Just stop now.
I can't. I'm sick.
We do see a lot of individuals that come to the emergency department with a lot of different addictions, alcohol being one of them. You really shouldn't just what we call cold turkey it or just stop the use of alcohol because you increase the risk of alcohol withdrawal seizures, delirium tremens.
Gotta try to take it easy from now on, son. Get Daddy another beer, will you?
No, you don't need another beer.
I know that!
Treatment for alcohol withdrawal typically is something called a benzodiazepine. First week or so, maybe a couple days shorter, a couple days longer, where you're in that withdrawal phase and we want somebody to get over the shakiness, the anxiety.
Dad, you just need to not drink so much. It's very simple.
I wish it was that simple, son. But if I don't give myself up to a higher power, then this disease is gonna kill me dead. I'm afraid the only thing that will cure me is a miracle.
There are a lot of resources out there, especially here in the United States, hospitals, rehab centers. There is one misconception that people will come to the emergency department for detox, but we do not provide that because the compliance thereafter studied has been really low. We will give you all the resources, but the individual has to set it up for themselves.
Excuse me, can someone explain to us why this is on our lunch trays?
Yeah, it's supposed to be sloppy Joe Day.
We asked for healthier options and to sometimes have food for those of us who don't eat red meat.
Oh my god. I'm about to lose my mind.
There's a huge debate of nutrition, what's the best diet. You're not getting things that have a lot of preservatives in them. I always tell patients the easiest way to go about this is to shop at the perimeter of a grocery store where there's produce, fruits and vegetables, fish and meats. Everything on the inside is in a box. Usually I would advise you to stay away from that.
You think you get your ideas about health and nutrition should be somehow interfering with that?
Eric!
You dictate what foods I can eat.
Oh, heart attack. He's doing the classic Levine sign. When somebody grabs and puts almost like a fist, he's grabbing a shirt, but same idea over the center part of your chest or a little bit to the left. Okay, somebody help him. So what is a heart attack? A heart attack has to do with decreased blood flow to the heart muscle itself. The blood is flowing to the heart all the time, but the heart itself needs blood to operate.
Clear!
You should say charging, charge ready, clear, I'm clear, you're clear, then you shock. Nobody's doing CPR, so we know this is not right. You wouldn't just be doing paddles. Where they place the paddles are actually in the wrong positions. So you want to do left lateral flank, right anterior chest, so that way the energy goes across down.
We got him back.
You Indy.
They shocked and they looked for a rhythm change, which you wouldn't do. You would use the energy, you would continue CPR for 2 more minutes.
Okay, hit him with pyroblast, Kyle.
Oh my gosh. Do we all have chickenpox?
What's wrong? Carpal tunnel. Carpal tunnel. It's
Carpal tunnel is when the median nerve going into your wrist passes through what's called a type of retinaculum, or your carpal tunnel, and it's compressing down too much to where it's actually pushing on your nerve, the nerve, causing you pain. Typically, treatment ends up being physical therapy, maybe sometimes steroids, and then last resort could be surgery.
Quick, we need Ben Gang. Hurry, dude. I've got it as fast as I can. You have to keep playing.
Bengay is a topical pain reliever that won't help with nerve pain, but might give temporary relief of secondary symptoms of discomfort. Oh my. What the heck was that? I can't believe they show this stuff. This is disgusting.
A few moments later.
The bedpan is a very old, like metal bedpan. We use plastic ones now so we can throw them out so they're not reused. We just got loose diarrhea kind of poo coming out. This is so unsanitary. Didn't wipe the buttocks, didn't clean it. Fecal matter has bacteria in it. One that we always worry about is E. coli, so please clean up.
All right, Kenny, drink your elixir of the mongoose. I'm now going to use mocking blow.
I first thought this was chickenpox, but this could be like acne from not bathing. They all look like they're a little unkempt. Maybe they've been playing video games for a little bit too long.
Okay, let's see. Lights, mood, start counseling timer. Okay, there we go. Okay, we got it. Okay, now, Kyle, you have some concerns about your little brother?
What the heck? Totally inappropriate. I'll call it out. A counselor or adult with a kid in the bathroom that's not your own child, not appropriate.
Well, it sounds like he's hitting puberty.
Yeah, he just seems so young.
Well, your brother is Canadian. Perhaps Canadian puberty is a little different.
Canadian puberty and anybody else's puberty, it's all the same. Puberty, simplistically, is a major change in your brain and your body when you go from child to adulthood. We grow, we get body hair, skin gets oily.
Voice changes.
We can make a whole separate video about that.
Hello, young people, and welcome to the most fascinating time of your life. You have braved the trials of childhood, and now you are reaching Canadian puberty. By now, you've probably noticed some changes in your body. For instance, when you fart, your gets hard.
This is a weird video. It doesn't correlate to actual puberty of what's actually going on.
If you're a boy, you may notice that your testicles ache. Or if you're a girl, you may notice a tingling sensation in your strange.
And you're strange. Not everybody goes through it exactly at the same time, and that is quite normal. It happens anywhere between the age of 8 to all the way up to 16. Doesn't mean anything very specific, just means, hey, this is the time your body is going through puberty.
We need to talk.
Okay, first off, what the heck are we serving? We got Diet Dr. Pepper. We have something that probably looks like Sprite and milk.
Soda, OJ, purple stuff.
We should be aiming for water.
It's a real disease. It's called hoarding. People who can't throw anything away, and they just keep living in deeper and deeper filth until the people around them just can't take it anymore.
Hoarding is actually a mental health condition defined by the DSM-5, which is a psychiatric book defining these type of disorders. And it's on the spectrum of something like OCD. This is real, and people do have issues with it and need to be addressed.
Look, it isn't that big a deal. I just throw this stuff away.
Old sandwich in a baggie filled with maggots.
Oh.
Well, I kind of need that. Let's just keep that.
Old food that's rotten and now maggots are there definitely needs to be thrown out. We do have patients that come in not just with rotten food that we find, but we actually find maggots on individuals.
This is breaking news. Here's Anchorman Aaron Brown. Incredible, absolutely amazing news today. A man from the future has come back in time and is in a government hospital after being hit by a car.
If you're like this guy who saw the future and now you're way too stressed out to sleep at night, Do Not Disturb is your time travel friendly sleep aid. Grab it at lifehappens.com or on Amazon.
Experts and scientists have been with the man from the future for several hours now and have been able to learn that he is from the year 3045.
The scientists have been able to communicate further and have uncovered that the man from 1,000 years in the future has come to our time looking for work.
He got hit by a car. We don't see any bandages. He looks like he's sitting up okay. No major trauma. But when a person gets hit by a car, the amount of trauma that the body endures is massive. It could be anywhere from a scraped and bruised to ending somebody's life.
He has said that the future is so overwhelmingly overpopulated that there are simply no jobs in his time.
What?
And so he built a time portal and has come back to 21st century America to find a job here.
Some experts out there say even though we are about 8 billion strong in the total world, they're predicting that we're actually going to have a less population in 100 years because people are not procreating or not producing more individuals as they did before. So we will see.
It's very important to take the time to shut out the outside world. In the Hindu religion, there's a saying, Namaste. It means, you, I have anxiety.
Oh my gosh. It means I bow to you. It's a statement of like respect or hello. What is anxiety? So it's a human emotion, feelings of uneasiness, worry, feeling not in control. A few signs that you may have anxiety is excessive worry, muscle tension, difficulty with sleep, waking up easy.
Mayor, we have to raise money, get everyone who has anxiety the tools they need to cope.
Some people have really simple anxieties or phobias versus other individuals have generalized anxiety that spans a huge spectrum of everyday activities, events. People have different ways of coping with it via activities versus talking through it versus medications.
How do you suggest we do this?
Namaste.
Right back at you. Being inside of an emergency department where there's a lot of stimulus going on could make matters worse. So certain hospitals have spaces that are specially designed for individuals that might have heightened emotional states.
Very interesting.
What is it, Doc?
Well, your temperature is only 55 degrees.
55 degrees. We don't know if that's Fahrenheit or Celsius.
I'm not going to tell the joke in Celsius in America.
I'm assuming it's Fahrenheit, because Celsius, you'd be really hot. Fahrenheit, you're super cold. Neither one are going to be compatible with life. Human body's temperature is optimally 98.7 degrees Fahrenheit or 37 degrees Celsius.
You have no pulse, no heartbeat, and your eyes are all puffy and sticky.
There are times when somebody might be alive but not have a palpable pulse. And that is actually when they're on something called an LVAD. It's just flowing the blood through the heart for you while you're waiting pretty much for a heart transplant. But you're still alive.
Oh no, you mean?
Yeah, I'm afraid the two of you have pink eye.
Pink eye, aka conjunctivitis. Most common reason for conjunctivitis is a viral reason. Doctors typically will prescribe an antibiotic, topical ointment, or drop to maybe protect you from getting a super infection with bacterial conjunctivitis.
School
children are often experimenting with dangerous ways to get high, okay, like sniffing glue.
Sniffing glue, or more commonly referred to as like inhalant abuse and use to get altered or have a sensation of euphoria, is really not good for you. You will become lightheaded, dizzy, potentially pass out, nauseous, vomit. You can fall, hit your head, crack your skull open.
But male cats, when they're marking their territory, spray a concentrated urine to fend off other male cats, and that can get you really high. Really high.
All right, this should keep my cat in place while
Oh my gosh. No, it doesn't get you euphoria, but can cause an infection in the eyes, could cause irritation and burning of your eyes or your nasal passages. People could potentially have allergic reactions or a type of dermatitis or irritation to the skin.
Whoa!
Oh. Oh.
Do you feel anything?
Gross.
Well, Kenny, are you buzzed?
In the emergency department, the more common abused drugs that we actually see, people say it's not a drug, but marijuana or cannabis. But more often than not, nowadays we see cannabis-induced hyperemesis syndrome, and that's just due to the fact that there's so much THC in it.
Quiet not, Kenny. The Maury Povich Freak Show is on. Oh, all right then.
Oh my gosh. Okay, who watched Maury Povich or still does? Let me know in the comments.
Our next guest is a little girl who was born without a midsection. Please welcome Domla Jones.
Without a okay.
Sick, dude.
You're a very brave little girl, and I'm very proud of you.
Thank you.
No midsection. So what does that mean? No abdominal contents, no pelvis, there's no urogenital system, there's no GI tract. All things that really aren't compatible with life. You need to be able to filter out what goes into your body. You need your kidneys functioning. Your liver is important for filtration and getting rid of toxins.
I have a friend, he has a deformity. I think it'd be perfect for your show. Great! His condition? He has a condition called chin ballitis. Yes, his balls actually hang from his chin.
Chin ball.
Now we just blend the skin tones, add a little hair, and presto!
Wow.
Wow, that looks awesome!
Supporting friends, so that looks awesome. There are times when people actually might get traumatic injuries or bad infections to where the scrotum and testicles are destroyed and might actually need new ones. Sometimes you can actually do transplants, and other times you can actually use prosthesis.
Thanks for coming on the show, kid. Mario's
Butters.
very excited to meet you. And this is the green room where you can hang out with the other guests until we call for you on set.
Okay, what do we got here? That extra foot is something called polymylia, the presence of extra limbs, so it's not out of the realm of possibilities.
Boy with balls on chin, this is man with foot on head. Girl with rapid aging disease.
There is a syndrome called progeria where you do rapidly age.
Wow, scooped out face guy. I've seen you on TV before.
Yes, this is my fixed appearance.
Wow, scooped out face. Interesting. So the question ends up being, could you be born without that part of your face, or was there a traumatic injury that occurred as well?
Back now with more on Martha Stewart Living.
In the past few days, we've all heard of the benefits of introrectogestion.
What? What did I just hear? I'm assuming this is food up the exit hole, up your buttocks. Yeah, no. Please don't do that. Sometimes we'll do enemas to help get stool out. Put medication sometimes up the buttocks in case somebody can't ingest.
Now, everyone knows that some foods are simple to shove up the puddings, soups, raisins.
I can't believe this is actually on South Park. I don't see meals like this being put up, but occasionally we do see fruits and vegetables placed up the rectum. Cucumbers, bananas, mangoes. Mangoes! Please don't do that. Your body is negative pressure. Once it goes to a certain distance, you may have an issue getting it out. You may need to have surgery.
But we can also still eat our favorite foods. What we're going to do today is prepare a Thanksgiving turkey for introrecto. Now, the key to shoving a turkey up your is first wrapping it in string, keeping the pointy
Stop
wings
it.
side.
Living in Southern California, we get people who are body stuffers to transport illegal things over the border, and we'll find those as well. But I would say you're not getting any food nutrients this route. Please make sure that you're chewing your food, swallowing it, allowing your body to digest it from the top-down approach.
Yeah, get it up there. Yeah. Ah. Yeah. Ugh.
That's awful.
Whew. And that is how you eat a turkey. We'll be right back with more.
You're not breaking that down. You're not digesting it. You're actually increasing the risk of obstruction, bleeding, potentially of injuring your pelvic bones and musculature. Not good.